Good morning, ladies and gentlemen. Allow me to present my pre-oral presentation entitled Accessible Tourism Practices for Travelers with Disability in Selected Tourist Destination of Region 4A. My advisor is Dr. Antonino Alejandro, and my name is Eleanor Tanteo. From the title itself, Accessible Tourism Practices for Travelers with Disability, my, my, my thesis is focusing on travelers with disability. Who are these travelers with disability? These people are those impaired with limitation in one's capacity to move freely on a given environment and participation restriction. They have health condition in that individuals' contextual factors such as environment and personal factors. They have compromise between medical and social barriers, but this disabled group of people contributes about 117 billion US dollars per year according to BISGEM in 2011 in Alan 2013. And what do we mean by accessible tourism? It's a form of tourism that entails strategically planned collaboration processes between stakeholders that enable people with access requirements, including mobility, vision, hearing, and cognitive dimensions of access to function independently and with equity and dignity through the delivery of universally designed tourism products, services, and environment. And what do we mean by universal design? The universal design are design of products and environments, programs, and services to be useful to all people to the greatest extent possible without the need for adaptation or specialized design. My entire thesis will be focusing on the universal design, adaptation of universal design of various tourism and entities. It's a way of thinking about design to eliminate barriers and make things easier to use, regardless of what type of tourist travelers are there. And it's the best approach to designing things that are accessible and user friendly for the entire population. This is one of the many examples of a universal design accessible room. How about in the Philippines? What is accessible tourism in principle of universal design in our tourism industry or in the tourism concept? It forms part of the strategic action programs of the NTDP plan 2016 to 2022 by the DOT based on the principles of sustainable tourism, sustainable tourism development aimed at tourism quality. So we have this malasakit, pagbabago, and kaunlaran. When we talk of malasakit, definitely it cares about people who have this difficulty in assessing or accessing various destinations. And in the Philippines, we also have this RA 7277 or Magna Carta for Disabled Person, which states that the state shall ensure the attainment of a barrier-free environment that will enable disabled persons to have access in public and private buildings and establishments in such other places mentioned in accessibility law. Well, let's come now to my thesis statement. My statement here is to investigate the implementation of the principles of accessible tourism in selected tourism destinations in Region 4A, thus minimizing barriers encountered by the PWD and make them function independently with equity and dignity. At the same time, enable the tourist destination benefit economically. So what's the background of my study? I will be focusing on Region 4A. Region 4A comprising of the provinces of Cavite, Laguna, Batangas, Rizal, and Quezon. These are the various tourist destination activities and famous foods in the province of Cavite. This is in the province of Laguna, and this are in the province of Batangas, which are adjacent provinces from Metro Manila. And due to the proximity of these provinces from Manila, it is commonly visited by all types of tourists. And accessible tourism can be best developed in this region of the country. These are also the famous golf courses in Cavite. In Region 4A. The tourist arrival in 2016 in Region 4A for day tourists are about 26 million and overnight tourists are 5.1 million. This source came from the DOT. Unfortunately, there were no records on the types of tourists that arrived in Region 4A. What's the statement of the problem? The study aims to determine the tourism practices for travelers with disability in selected tourist destinations in Region 4A or Calabarzon. So it specifically answered these questions. What are the key motivational factors of PWD to participate in tourism activities in selected tourist destination in Region 4A based on the disability dimension of access, which are the dimension of disability, support needs, access enablers, and universal design with categories mobility, vision, hearing, cognitive learning, mental health, and sensitivities. The second specific question will be, what is the extent of the implementation of the principles of universal design so that tourist attraction will be accessible in PWD in selected destination in Region 4A based on the principles of universal designs, such as, namely, equitable use, flexibility in use, simple and intuitive use, perceptive information, tolerance to error, low physical effort, size and space for approach and use. Third will be, what types of barriers affect the accessibility of PWD in the selected destination in Region 4A based on the environment and social barrier. And last is, what are the policy frameworks that can be recommended to improve the implementation of the principles of universal design by UNWTO so the selected tourist destination in Region 4A will be more accessible to PWD. The statement of hypothesis will be, these are the four hypotheses of my study, which are there's no significant difference in the extent of the implementation of the principle of universal design in the tourist selected destination in Region 4A, which are all based in 0.05 level of significance. What is the significance of the study? This will provide inputs in formulation current tourism policies for the Department of Tourism. This will provide inputs in innovating new marketing strategies that will be focusing on the needs of the travelers with disability to motivate them to travel in Region 4A. And this will make, for the NCDA, this will make them aware of the big role in removing the barriers to accessibility in selected province destinations in Region 4A. And for the LGU in Region 4A, it will guide them in planning and developing and implementation accessible tourism in the region. For tour operators, it will guide them in assembling or creating different tour packages for the people with disability. For the tourism stakeholder, it will guide them in the innovation and delivery of the respective tourism products and services, matching the accessibility requirements of the travelers with disability. For the local communities, will make them aware of the access requirements of the travelers with disability so they can adjust the quality of the services. And lastly, the future researchers can enlighten them about the gaps between the access requirements of travelers with disability and delivery of tourism products in Region 4A. What are the scope and limitation of the study? It will only cover the three provinces, unlike the other, not excluding the other provinces in Region 4A, and will be covering only Cavite, Laguna, and Batangas. The scope of study is descriptive in design using a mixed approach of quantitative and qualitative approach to determine the accessible tourism practices for travelers with disabilities in selected tourist destination in Region 4A or Calabarzon, using 200 respondents approximately from Calabarzon. The limitation of the studies on the number of travel components. I won't be I won't be using all the entire components, but I will be selecting only. And the review of for the review of the related literature, it was my I was guided by the traits of tourists with disability as being the local high spenders and influencer. It has a great potential business opportunity. The change of understanding that disability is not a problem but limitation of a person caused by society. A more sophisticated understanding of accessible destination experience is needed by tourism operators. There's a need in realizing implementing strategies that achieve the principles of universal design and access. Tourism are for all should be accessible, sustainable, and social. Tourism info for PWD travelers be focused on the context and travel history and less on technicalities. Accessibility is not a medical condition, but a dynamic interaction between health conditions and contextual factors, both personal and environment, and concept for developing an understanding of accessible tourism based on the disability dimension, support needs, and enablers and the universal design. The synthesis is the study aims to determine the implementation of the principle of universal design in its relationship to the motivational factors of PWD so they could access the tourist attraction in selected tourist destination in Region 4A. This will enable also all the tourist businesses to design their own tourism products and services based on the 7 principles of universal design, namely equitable use, flexibility in use, simple and intuitive use, perceptible information, tolerance for error, low physical effort, and size and space for approach and use. The theoretical frameworks will be focusing on the universal approaches from the in every stage. A person's consideration, a universal system composed of the following, composed of the person's consideration, travel and planning decision, transit, destination, transit, then traveler's reflections, and feedbacks. But the traveler's consideration would have the stages of influenced by the socio-economic circumstances, disability dimension of access, support needs, and previous experiences. For the conceptual framework, framework of the study is based on the universal approaches to accessible tourism by Buhalis and Darcy. In the accessible dimension access, we have different kind of access, namely the mobility, the the vision, um, the hearing, the cognitive learning, and issues of speech and understanding. And based on this dimension of access, the tourism stakeholders in selected tourism destination in Region 4A should create an environment wherein goods, products, and services, as well as object or instrument or tools or device, must be comprehensible, usable, and practicable to all persons safely and comfortably. And the implementation of the principles of universal design is not only limited to Region 4A. This is also can cover other elements of the travel path of the tourist with disability, from a person's considerations, travel planning, decision making, transit to destination, transit to travel, reflection, feedback, and tourism environment organization of responses. The research methodology will be descriptive, quantitative, and qualitative. Respondent of the study and sampling will be the population of the study covers the tourism stakeholder from the DOT regional office, tourism officers, managers and supervisors, foreign domestic tourists, and local community. The sample group will be chosen from the population through snowball sampling, purposive, and convenience sampling. The division will be like this, for a total of 200. The research instrument will be a survey questionnaire, self-made questionnaire on the principle, basing on the principle of universal design on selected destination. And these are all based in the theoretical and conceptual framework. This will be the Likert scale. This will be the arbitrary interpretation of the ratings of respondents. Other instrument will be the document analysis. And researcher, I will be gathering primary data from the 1987 Constitution, DOT guidelines, municipal ordinance. And secondary data will be from the DOT and non-DOT accredited resource. Data gathering procedure will be approval from the Dean of Graduate School, approval from the offices of the respondents, and the statistical treatment will be frequency and percentage, weight, mean average, standard deviation, analysis of variance, Pearson R correlation. The hypothesis of the study, as I mentioned a while ago, will be like this. The statistical treatment will be. So thank you very much.